Alan Lindemann, Doc. What's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic's pre-eclampsia. What's the name of your pregnancy and postpartum book?
It's called Pregnancy Your Way, Choose a Safe and Happy Birth.
Why pick this title?
Well, our book is a how-to self-help book, not just an explanation of pregnancy. I've delivered 6,000 babies in 40 years, and I've gained a lot of information that you can get by reading the book. And this information might even save your life.
What is pre-eclampsia?
Well, it's a triad. There are three things that are necessary: high blood pressure, overactive reflexes, and protein in the urine.
Okay. What are the symptoms of pre-eclampsia?
Well, I want to just talk about the difference between a symptom and a sign. A symptom is like a headache. It's something that the patient finds. A sign is something that the doctor finds in the office visit. So during the early and middle stages of pre-eclampsia, there are no symptoms. You don't know you have it. That's one of the reasons that some people say it's surprising and unpredictable. I find it neither. You don't know you have it, so you have to pay attention to early signs like high blood pressure reading.
Can you predict who will get pre-eclampsia?
Absolutely not.
Does being very healthy decrease my risk for having pre-eclampsia?
No, it doesn't. I think there's a lot of people who labor under that false understanding that good health will prevent preeclampsia, which is totally only pregnancy related.
Does exercising decrease my risk for pre-eclampsia?
Not at all. Some of our long distance runners, the gold medal winners, get preeclampsia.
What is the first sign that I have pre-eclampsia?
It is one, elevated blood pressure in your physician's office or even at home.
If I have one elevated blood pressure, what should I do?
Well, I recommend that everybody should get a blood pressure cuff, learn how to use it, and check your pressure twice a day. Now, there are people who are raising Cain about the value of home blood pressure cuffs because they think they're not accurate. It really doesn't matter, because what you're looking for is a trend, and one blood pressure cuff will tell you whether your blood pressure is going up the next day or not.
If my blood pressure is elevated at home, what should I do?
I recommend modifying activity. For example, if you have 3 12-hour shifts, making 36 hours a week, I'd recommend, first of all, trying to cut back to, say, 4 8-hour shifts. That'll give you 32 hours a week.
Should I bed rest?
Well, years ago, bed rest was popular. I can remember in my residency, we made patients have bed rest in the hospital. But bed rest has been proven to be neither safe nor effective, and it is no longer recommended for pregnant women.
What's the difference between preeclampsia and eclampsia?
Well, eclampsia is pre-eclampsia with a seizure.
Are preeclampsia and eclampsia possible after birth?
Well, unfortunately, they are. A lot of young women run into trouble by having an exacerbation or an increase in blood pressure problems after delivery. And you have to watch patients for about a week, maybe a little bit more. But a lot of bad things can happen during pregnancy, during the postpartum time, like a liver capsule rupture. That's almost certain death.
What actually happens with preeclampsia?
Well, that is a restricted blood volume. The most important part of pregnancy is to have an increased blood volume, more serum, that's a straw-colored liquid, protein-rich in your blood, and more red cells. So normal pregnancy has about a 30 to 50% increase in blood volume. So preeclampsia, the sign of preeclampsia is when you don't do that, when you keep your original smaller blood volume.
Is anemia a sign of sickness in pregnancy?
Absolutely not. A little bit of anemia is what you consider to be normal for pregnancy. As a matter of fact, I always worry about patients if I see their hemoglobin is high or if I see that it's rising.
Can hemoglobin be too high during pregnancy?
Absolutely. Yeah, I think that an elevated hemoglobin is a part of preeclampsia, and it also could be part of HELP syndrome. The problem with HELP syndrome is that you can have a lot of bleeding, so or elevated hemoglobin would not be a sign later on with HELP, but it would be a sign in the beginning.
So you can go to worlddocallen.com and pick up Pregnancy Your Way and Modern Medicine, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast, guys.